everyone, welcome to episode 9 of BCG's Health Tech Videos. I am Ariel Rothman, and today's moderator is Adina Symreng, partner at BCG. I'm excited to introduce today's panelists who are here to discuss pediatric mental health. Hafeezah Muhammad is founder and CEO at Backpack Healthcare, and Omkar Kulkarni is VP, Chief Transformation Officer, and Chief Digital Officer at Children's Hospital Los Angeles. Thank you all so much for joining, and I'll pass it off to Adina to begin the discussion.
Thank you, Ariel. And first of all, Hafeezah, Omkar, really excited to have you both here. As a starting point, nearly 20% of children and young people aged 3 to 17 in the United States have a mental, emotional, or behavioral disorder. And suicidal behaviors among high school students have increased more than 40% in the decade preceding 2019. Against this backdrop, this discussion feels really pertinent, and it's clear that pediatric mental health is a critical issue. I'm really looking forward to discussing with you today how health tech can help solve this and what the critical requirements are to achieve success in this demographic. So let's jump into it. I thought we could take a starting point but by discussing the needs of pediatric. For this patient group, what are the needs that are truly unique and that require specialized digital solutions?
If you think about adolescents and young adults, which is largely where I imagine this conversation's focused, engaging with that population digitally, especially given all the other digital opportunities they have in terms of engagement, is really crucial. So thinking about user experience, thinking about how you engage these users to spend their time with you as opposed to any other digital, opportunity they may have is really critical. There are other things to consider. I always like to remind people that the pediatric population in this country is by far the most ethnically and linguistically diverse population in the country, and a population that expects society to respect its identity, respect individuality, respect customization as it relates to how organizations interact with individuals. They've kind of been used to it their whole lives, many of these individuals, these patients, and so they're expected from digital solutions that are designed for them. So not only do you have to think about digital engagement, but you also have to think about making sure these solutions are built in the language, with culturally and ethnically appropriate and relevant topics, and thinking about ways that an individual's identity can be a part of the way their solution is designed.
Hafeezah, what would you add from your vantage point and experience?
My experience is a very personal experience. I started my company because in October of 2020, my son, who was 6, told me he wanted to kill himself. So when you talk about the rates that's impacting the children within the US, I know what that feels like directly. And as I continue to think about solutions that can help engage children and what technologies are out there to make a difference, I searched for a year and was unable to find something that was engaging, that had cultural intentional care. Because as Omkar said, right now, more than 50% of the children in the US are minorities or from multicultural households. This is the first time in history that has happened where those children has become the majority. So as we think about how we think about the technology and how we enhance and how we become better, we have to think of from the lens of equity, inclusion. How do we see how these children portray themselves? There's a lot of competition between, various social media. So how do you ensure your stuff is engaging and that can combat those solutions that they see out there that sometimes impact their mental health?
Thanks, Hafeezah. Really appreciate you sharing that. Moving into our second topic here, wanted to touch a bit upon sort of an unlock that's crucial to enable access for these kids. And obviously, the economic part of this is important as well. So my second question would be, how does Medicaid play a special role in pediatric mental health? And how can you unlock viable economic models through Medicaid-supported payments?
So the Medicaid population is our primary focus population. One thing I saw that was a tremendous gap in the market was that data. How do we utilize outcomes to be able to get the Medicaid payers and providers on board with more lucrative reimbursement models? How do we take it to a step further to engage the technology solutions that's going to be attractive to have a full end-to-end journey in regards to how they're willing to pay for providers. Surprisingly and excitingly, we are the first telemental health company to have a value-based agreement with Medicaid that helps us to improve our reimbursements. But it all started by providing the right data upfront to be able to collect it, analyze it to prove outcomes, but have a technology solution that can help children in between sessions as you provide a one-on-one care for these families. Data, data, data.
I agree. I think data is really crucial. So many of your audience may not know, but it's interesting that about 27 million kids in this country are covered by Medicaid. And that is largely because that is the public health insurance option for children. We don't have Medicare, right? For children, Medicare is for people who are over 65. So for children, Medicaid is that vehicle. And the challenge there is Medicaid is administered at a state by state level. So whereas with Medicare, you typically have Medicare somewhat uniformly administered across the 50 states. Medicaid plans differ quite significantly from state to state. So as you're an innovator, a technologist, you're building a company that has a technology like Backpack or others, the challenge is that you sometimes have to have a multi-state strategy because you're not necessarily getting a contract with multiple states. And so that's something to think about as you think about Medicaid. But the beauty is most patients who are being treated for some of these conditions who are on Medicaid are likely part of Medicaid managed care plans. And so these plans, because specifically the margins are so tight for them, because they struggle sometimes with having enough funds to cover the healthcare costs of their covered lives, they're eagerly looking for ways to partner with innovators to think about how they can better manage their populations in a cost-effective manner. And mental and behavioral health is typically, top of the list. Many Medicaid plans, like in California, are actually contracted out to county mental health plans. And so in California here, we've got mental health not just administered by the state, but it's actually our county in Los Angeles, which is where I am. It has a heavy role to play in terms of how mental health is administered. And we've got a very favorable county mental health plan here. And so we have a good opportunity to collaborate with them and think about innovative solutions, including virtual care and other things to help drive better mental health outcomes for our kids. But the challenge for an entrepreneur is you've got to know all these things. You've got to be able to figure out where the mental health decisions are being made for the Medicaid patients, what the right plans are, what the big players are. But there's opportunities there. And the other thing I'll add before I end, beyond Medicaid, a lot of states, California, Colorado, Nevada, North Carolina, many, Texas, have come up with additional funding because there is a pediatric mental health crisis in their state, to think about innovation and think about how new solutions, new care models can help improve access and treatment options for kids and adolescents. And so it's all about, researching and figuring out where that money is and how to apply for those grants and how to get access to that funding, because it is there. You just have to find it and figure out how to apply for it.
In regards to unlocking the school funding, it takes leverage and work. And how do you partner with school districts? How do you bring a value to them? From my experience, I know sometimes it could be a challenge with the schools as they navigate how to get that funding to expand mental health services within their schools. But the funding is there. Some of it is due to expire in 2024, but it's really critical because this is where majority of the kids are located.
And just to add to that, the same way many kids in this country rely on schools to provide food, for them because they are food insecure. Many students are starting to rely on schools for mental health services as well. So it's schools are a tremendous opportunity. Many kids, spend so much time at school. Sometimes they spend more of their waking hours at school than they do at home or in other places. And so having those resources and those connection points are crucial. Often the educators and the administrators in schools get more face time and time with kids so they can identify, patients that need the services or at least need to be screened. Partnering with schools for tech companies, but also for providers is really crucial in my opinion, because it's not just about a doctor. I mean, doctor's a crucial part of the care team, but school nurse, school teachers, school administrators, folks in the schools, coaches as well, athletic teams. I mean, anytime a student or a young person is away from home and away from parents and caregivers, all the other adults that are kind of involved in their life, I think, are crucial parts of the mental health solution for these kids. And so we have to engage them as we think about this technology.
Maybe as a follow-up, in engaging them as a provider, someone who wants to bring their services to these children, what are key unlocks to sort of ensure that penetrates across all of the school corridors?
This is from my experience. So we provide tech assets, in addition to workshops and one-on-one therapy across our business lines. One thing that's been critical for us is workshops for teachers and how to help them manage their mental health. A lot of times we think about the child, but there's a lot of pressure that teachers face in regards to how do you manage a large classroom of children where at least 20% of them are struggling with that mental health. And I feel that if you want to be able to penetrate, and what has worked for us is to focus on the teachers and how do you help them provide that support. And then once they're able to understand how to identify a child that's struggling, identify how to improve their own mental health, then they're more likely to ensure the solutions that are being delivered to the school gets in the hands of the kids, because they see the burden that's going to be lifted off of them and the way that they educate on a day-to-day basis. And that's something that has worked for us. And that's what I see, that we focus a lot on the children, but the teachers are equally in pain. And think about it, 20% of their kids in that classroom is struggling. So how do we help those who help those?
I think this is a really interesting conversation. I really appreciate those perspectives. And it kind of moves us forward to the next question, which was around who else do you need to engage beyond the child? We talked about teachers, guidance counselors. Are there others? What about primary care? How about engaging with the parents, community workers? Who are those other key stakeholders? And how does health tech support those connections?
There is a lack of communication and data exchange between all those different providers. So everyone you mentioned is important in different ways for every student, right? So not every student has access to those people. And so as you think about a care model, it's hard because you're not necessarily accessing the same people. And they're all in different places using different technology systems, some not even using systems at all. But I think the piece that's most, I think, challenging and typically falls on the parent, which is the hardest part, is there's no single source of information, right? There's no single record that's out there that connects between the primary care, the specialty care, the therapist, the school nurse, the counselors, the county mental health center, the Medicaid, all these places, right? And so the parent has to keep kind of physically managing all that information. It's really hard for them. And often they may not have all the information. Sometimes these conversations are happening, especially for older teenagers, in settings where parents may not be fully aware of everything happening. So that's just a key enabler that is still missing, I think, and I think technology can play a great role, is how to connect all that information, creating a mental health kind of personal record for kids as they navigate all these different stakeholders.
It sounds like that's an issue, though, that is perhaps not so specific for pediatric mental health, in the sense that I feel in the healthcare system, irrespective of sector, when you move from primary care to specialty care to community care to social care and so forth, the data tends to be a bit siloed, and it's hard to get the full picture of both the patient's health and the resources available. But I can see how in this setting, where you have even more stakeholders that are involved in the care of the child, that the siloed data structure would create even greater challenges, but also greater potential if the pain point was to be solved. Have you seen any efforts at trying to, at least in specific areas, solve for that challenge, or is that more of a wish for the future?
We actually had to build an integration of how do you get authorization from the school, the parents, all the caregivers to load them within the child solution, so the child can see, at least for backpack patients, their stakeholders can see what's happening with their child. We had to build it because it wasn't available.
The only thing I'll add is I think there is hope in the sense that the generation we're talking about, and probably subsequent generations to follow, meaning people under the age of 18, they are used to having digital identity. Their entire lives, probably from birth, are somehow digitally captured. And so it's the concept of it, even though it hasn't been executed yet, of having kind of a central repository of all your, mental health information. It doesn't seem foreign. Whereas I imagine for a 70-year-old or an 80-year-old, the idea of a digital repository, while perhaps acceptable, is a little, out of realm. So I'm hopeful that if we can figure out how to, I think technologically it's feasible to do. I think it's just about how you get interoperability across all these different, creators of that data, including some that may be creating it in paper form, right? So it's not like everybody's on a digital format. So, things for your audience to think about as we think about the future.
Thanks a lot, Omkar. And thinking about the younger than 18 generation, thinking more specifically about my kids, they're ridiculously savvy and help me when it comes to tech-related issues. So it's clearly a new generation with other habits and other capabilities, perhaps growing up in a different way than I did. Omkar, Hafeezah, thank you so much for engaging with me in this conversation today. Really appreciate it.
Thank you. Thank you for having it.